Hi, I'm Seni Mylvaganam. I'm a consultant breast surgeon, and today I'd like to talk to you about how to choose the right breast implants. Here are my 7 key things you need to consider. So firstly, choosing the right breast implants is a crucial decision for patients, whether that's in the breast augmentation or reconstructive setting, because they play a major part, but not a complete part, in actually what your final cosmetic result will be. So, key thing number 1, implant type. So there are 2 primary types of breast implants. They're the saline and silicone implants. Now actually silicone implants are primarily what are used in the UK. We don't tend to use saline implants, though this can differ across the world. Silicone implants, what are their advantages? Well, often they offer a more natural look and feel, particularly as they hold form, and also if there is a rupture, they have resistance to bleeding out if a rupture does occur. Number 2, implant shape. So breast implants come in 2 shapes primarily. That's the round and the teardrop, or what's often called the anatomical shape. Now, round implants are symmetrical and provide fullness in the upper part of the breasts, creating a rounded appearance there. Teardrop implants are designed to mimic the natural shape of breasts. They have more fullness in the lower part. Now, I use both of them as options, and currently I use the Motiva implants, where you can have round implants, but because of the nature of the density of the silicone, different lines can offer either a more anatomical or teardrop shape or a more round shape. Consider your desired outcome and discuss this with your surgeon, and they will help decide the shape which best complements your body type and what gets you to your aesthetic goals. Number 3, implant size. So choosing the appropriate implant size is also essential for achieving that desired breast size, but also breast proportions to give you the aesthetic outcome you wish for. There are factors such as your body frame, existing breast tissue, and also personal preferences that help impact on that decision. Your surgeon will guide you through these and the selection process. They'll take measurements and provide recommendations based on your unique anatomy. Visual aids such as before and after photos can also help, and there are also tools such as 3D modeling, such as the Chrysalix model, that can also help with providing you with some idea of what you might expect. Number 4, implant profile. So implant profiles refers to the projection or how much the implant extends forward from the chest wall. It determines the degree of fullness and cleavage. Now, implant profiles typically range from something that's low to something that's high or ultra high. A low profile implant provides a more subtle augmentation, whilst a high profile implant offers a more prominent projection. Your surgeon will assess your chest wall dimensions and discuss the available options to achieve your desired outcome that complement your frame. Number 5, implant texture. Now, breast implants can have a smooth or textured surface. Smooth implants have a softer feel and can move within the breast pocket, giving a more natural feel. Textured implants have a slightly rough surface, which may reduce the risk of implant rotation and capsular contracture, which is scar tissue formation around the implant. However, with round implants that are smooth, one might see some drop if one doesn't look at how you secure the pocket, which your surgeon will talk to you about. Your surgeon will consider factors such as your anatomy, your aesthetic goals, and potential risks when recommending the appropriate texture of implant for you, whether that is smooth or textured. Number 6, surgical incision options. Different incision options are available for implant placement. They include the inframammary or under the breast crease, the periareola, which is around your areola, the transaxillary, which is through the armpit, and even the transumbilical, which is through the navel or belly button. Now, each option has its advantages as well as considerations to think about. Discuss these options with your surgeon and they'll help determine the most suitable incision for your specific case. And finally, number 7, safety and quality. Ensure the breast implants you choose are FDA approved if you're in America, or here in the UK, MHRA approved, and that they meet the safety standards set by regulatory authorities. High quality implants from reputable manufacturers have undergone rigorous testing and have a proven track record of safety and reliability. Your surgeon will recommend trusted implant brands and provide you with information on their safety profiles. So that's my 7 key tips. So in conclusion, selecting the right breast implants is a collaborative process between you and your surgeon. Remember these 7 things to consider. So they are implant type, shape, size, profile, texture, incision options, and safety. And use those with your surgeon to help decide what is right for you to achieve your desired outcomes. Openly communicate your goals and preferences to your surgeon, and they will then best be able to help decide that choice which gets you to the goals you want. Remember that every individual is unique and your surgeon will tailor the selection to your specific needs and requirements. All the very best.